This is Fort Payne Pediatrics Annual RHC Information Update and Review, as well as Emergency Preparedness Review. This will briefly go over what you need to know regarding our rural health clinic. The RHC Fact Sheet is a comprehensive resource with general information about rural health clinics. We have one located in the kitchen. Who is owner and medical director? Dr. Peter is the owner and medical director of Fort Payne Pediatrics. An organization chart is something that an inspector will likely ask about. It is important that you are familiar with what that is and key components of that. If you do not know what that is, think of it as a chain of command. 3 important things to know is who your immediate supervisor is, who our office manager is or who is in charge of day-to-day operations, that is now Morgan Gregory, and who our medical director is. Again, our medical director is Dr. Peter Strogov. HIPAA confidentiality agreement. All personnel must strictly observe these protocols to protect patients' protected health information, PHI, at all times. Do you know your job description? Find your specific role and responsibilities in the RHC manual. Workplace injury. All employees should immediately report any injury with potential injury of a patient or staff member to the healthcare provider or their supervisor. The healthcare provider will decide if there is any potential injury to the employee or patient and will complete the clinic incident report form. This form should be submitted to Morgan Gregory or Danielle Blaylock within 48 hours. All oxygen tanks should be properly stored and maintained to ensure safety and availability. If you work in the clinical area and do not feel comfortable operating an oxygen tank, please let Danielle know ASAP. Maintaining a clean and hygienic environment is essential for the well-being of patients and staff. Infection control. Strict adherence to hand hygiene, glove usage, and cross-contamination prevention is essential for infection control. Hand hygiene is very important for our own and our patients' safety. Thorough hand washing or use of alcohol antiseptic hand rub before and after patient contact. Hand hygiene. Proper hand washing technique, including lathering and friction, to ensure effective cleaning. Infection control, gloves. Review the following guidelines for glove usage, changing, and disposal to prevent the spread of infections. Handling suspected highly contagious patients is something all staff should be aware of. There are protocols for managing suspected highly contagious patients, including isolation and disinfection. If a parent reports concern for a possible highly contagious illness, such as measles, chickenpox, etc., they should wait in the car and notify the EMA so they can proceed appropriately. Emergency care for the patient. Review the following information. According to the state of Alabama, a minor may provide their own consent for treatment. The 5 R's of safe medication administration are important to know to prevent medication errors. Emergency preparedness is a condition of being a rural health clinic. If the clinic is not in compliance with emergency preparedness, they run the risk of losing RHC status. A tabletop exercise and a full-scale exercise are required at least every other year. If there is an emergency plan activated, that can take the place of a full-scale exercise. What is an all-hazard assessment? Simply put, an all-hazard risk assessment is like making a list of all the things that could go wrong. A mitigation plan is the plan to reduce the damage. If you have to evacuate, remember to try to be calm and communicate clearly. Please remember, if we need to evacuate the building, direct staff and patients to the gravel parking lots across from the mailboxes. If there is a fire emergency, remember, RACE. Rescue anyone in immediate danger. Alert the fire department by calling 911. Contain the fire. And extinguish the fire if it is small and contained. Funny GIF break. It is the clinic's responsibility to keep patients and staff safe at all times. If we have severe weather, precautions will be taken to ensure everyone's safety. A tornado watch means that conditions are favorable for a thunderstorm or tornado to develop. Flash flooding may occur as a result of the storm. A tornado warning means that a thunderstorm or tornado has been sighted. If a siren sounds, stay inside and take cover. In the event of a tornado warning, the office manager or clinical supervisor will initiate the EP plan. Patients, visitors, and staff should be moved to interior rooms. Staff should gather flashlights and not leave until the storm has passed and the warning has lifted. Staff should stay calm and provide reassurance to patients. In the event of an active shooter, you should run and hide. As a last resort, fight. If a bomb threat is received over the phone, follow these steps. Keep the caller on the line as long as possible, ask the caller to repeat the message, ask her name, ask where the bomb is located, record the call, listen for distinguishing background noise, and note distinguishing voice characteristics. Funny GIF break. Here are some refreshers. Where are evacuation routes located? You should be able to find an evacuation map on the back of every door in the office. Where are fire extinguishers? In the 4 main hallways. What is our hand washing policy? Wash hands before and after patient contact and when soiled. Where should you document emergency transfers? In the lab manual in the lab. What should you do with expired medications? The answer is not give them to Danielle. You should document them as expired in the lab manual and discard them. Where is the SDS located? In the lab. If you do not know what an SDS is, please see Danielle. Where are the emergency medications? In the emergency box in a labeled cabinet in the lab. Who is the medical director? If you don't know the answer should be I'm not sure, but I can find it in the policy and procedure manual.